Right, good afternoon, ladies and gentlemen, and welcome to this meeting of the Perth and Kinross Integration Joint Board of Wednesday, the 19th of March, 2025. I'm Councillor Colin Stewart, I'm the chair of the board, and we'll proceed to item 1 on the agenda, which is our welcome and apologies or substitutions. We have, first of all, an apology from Heather Dunk, and Colleen Carlton from NHS Tayside is substituting for her. We also have an apology from the Vice Chair Beth Hamilton, and Mr Sam Riddle from NHS Tayside, I think is online, substituting for Beth. And I would like to welcome to his first meeting in the role Brian Jones, who's deputising for the Vice Chair for the moment. There are a couple of thanks that we should put out. We've got on the agenda later for information the NHS Tayside Director of Public Health annual report. We did actually have the opportunity on Friday at the IJB's development session to hear directly from Dr. Emma Fletcher, the Director of Public Health, but she's not able to be here today. I would, however, like to formally put on record our thanks as the board to Emma for her input. I know she's taking a career break, and we wish her well on her travels. And I would also like to thank, as this is her last meeting, Susie Brown as the representative, as the nurse director representative on the board. Thank you very much for your attendance and engagement as well at all of our meetings. Thank you. There's no other substitution. Okay, I don't think there are any other substitutions. So we'll move on to item 2 on the agenda, which is declarations of interest. Are there any declarations of interest and items of business on the agenda before us today? No. Oh, sorry, Ms. Carl.
No, I don't know if it's relevant. I'm usually on the Dundee IJB, just to make that clear, but that's fine, just in case.
No, that's fine. Item 3 then on the agenda is the minute of the meeting of Perth and Kinross Integration Joint Board of the 11th of December 2024 for approval. That minute is before us. Can we agree the minute of the December meeting? Sandra, Mrs. Auld, do you have a comment?
Yes, thank you, Chair. At last month's or the last meeting, I raised a question regarding CAMS, and there was a reply received from 2 other board meeting attendees. Neither my question nor the reply the replies are noted in the minutes.
Okay.
And can I, if it's okay, can I follow on from that, Chair? On that topic, which I then wrote to the Chief Officer immediately following the last IJB meeting, that was in mid-December. I didn't receive a reply to that until the early hours of this morning. And I guess I'm concerned that as a board member, I want to have confidence that the information that we're being given at these board meetings are correct, is correct. And certainly the reply to my question, and as in on a previous occasion when questions were asked about Strathmartin, and there was information given at a board meeting that then turned out to be incorrect. I would like an assurance that the information that is discussed and submitted at IJB meetings, that we can have confidence as board members that the information is not misleading.
Okay, so on the first point, just checked with the clerk of the board, and we're happy to make a note in the minute, just to make clear the first point you raised, Chief Officer.
Thank you very much. I think in relation to some of the questions, Sandra, that you're referencing relate to services that are not within my remit or within the auspices of the IJB. So therefore, it is very difficult to answer questions in live meetings when I don't have access to that information. The response that you reference from me this morning is providing you with a briefing that was provided yesterday by NHS Tayside in relation to CAM services to board members, and I sought clarification that was able to be shared with other parties. So I have done so. I don't have responsibilities for those services, so unable to answer questions about the veracity of the content of that. But I can only assume that if that's provided to board members, then it's been provided by those people who can. So, and in terms of transparency, the briefing will be shared with all IGB members as well. Thank you.
Thank you, Chair. Can I come back, please?
Yep.
Just I'll be brief. But as previously stated, the rationale for raising the issues around CAMs are with the understanding that the IJB does not have responsibility for CAM services, but as clearly stated, the concerns are of the knock-on impact of the decisions that are being made around CAM services to service users. So that's the rationale. And as I've said, to communicate in mid-December and have no response whatsoever in this length of time, not a holding response, not anything. I don't. I'm sorry, but I don't feel that that's acceptable or appropriate.
Okay, thanks, Mrs. Auld. Certainly, the knock-on effect of CAMs on the work of the Health and Social Care Partnership is something that we recognise and that we've been discussing actually just recently in terms of making sure that there's a joined-up approach across all of the community planning partners. But Chief Officer.
Thank you very much. And in fact, in the update on the strategic planning group, this very issue was raised and discussed, and the commitment to take forward an action to put in place a workshop with a wide range of stakeholders involved in that to consider what the whole age or issues are with a particular interest in transitions for young people transitioning into adult services. So that was certainly something that was a commitment that was taken forward, and we will organise that with all of the strategic planning group members involved in that. Thank you.
Okay. And Miss Hunter, you wanted to come.
Yeah, my it's just there's 2 spelling mistakes. I'm being really picky. I am missing a D in my name in the membership, and also can you turn around to Sir Ian, because it's replaced Ian Sir McCartney. Just to notice that I have read them. Okay, and I noticed it. Okay.
Thanks, Miss Hunter. We slip these things in deliberately just to check that people are reading. Okay, with that commitment to make an update, can we agree the minute of the last meeting? Yep. Okay, thank you. Item 4 on the agenda is the sorry. Yeah, Mrs. Summers.
Under 7.3, I had asked at last meeting if we were on target for August this year to relocate the LD services to Murray Royal. and also asked if about the support for the families. It's now 3 months later. Have you had a timescale from the contractors yet to say whether that's going to happen? And also, if I could have some feedback about the families.
Thank you very much for your question, Maureen. The points raised in the minute relate to the quarterly update, which the Executive Lead for Mental Health and Learning Disabilities, the Deputy Chief Executive for NHS Tayside. So there will be a further briefing at our next meeting in June, which will bring you up to speed on all of that. It was certainly a question that was raised at NHS Board just a couple of weeks ago, and at that point the NHS Board were informed that there were meetings with architects and the deadlines were continued to be under review, but I don't have a specific date that I could answer that. So I suggest that question is held over until we get the quarterly update from Sandra MacLeod. I think, Maureen, in terms of that, I couldn't give you an answer to that because I'm not responsible for the work. But just to say that those discussions are ongoing.
Okay, thank you. So we'll move on to the action point update, which is in the agenda pack. Action 147. We were going to hold a follow-up lessons learnt on that process, on the process followed in the Medvin branch surgery closure and previous branch closures, and we have completed that with the action, the discussion that we had at the development session last Friday that we've already referred to. The next item was item 150, which was an update on discharge without delay, and that is in the papers and on the agenda for today's meeting, so we will close that item. And item 151, there was a lead partner services update from Angus IJB, but we couldn't consider that at the December meeting, and so that will now be brought to the Audit and Performance Committee meeting, to the Audit and Performance Committee at their meeting in June 2025. So I propose that we close that one off as well. Any questions on the action point update? Not seeing any. So next is any matters arising, and I understand, Dr. Peterson, that you have an update for us on GP vacancies.
Yes, I think I was just asked to update just to give an idea of how many GP vacancies were in Perth and Kinross. This is actually really quite a difficult thing to know exactly for sure. I'm sure you appreciate it's time sensitive. What happens today might be very different from what happens tomorrow. One of the things that I would like to recognise, that although we talk about GPs, I would like it recognised that every single member of staff, no matter what their role, is fundamental in how GP practices function. I think it's really important that we recognise that even though full GPs, the lack of admin staff can have adverse effects as well. It's really challenging because there's no obligations for GP practices to tell us about their vacancies, and also there's lots of different methods for people to advertise and also approach other GPs to recruit. It can change very quickly, and we need to consider as well, we talk about numbers, but we also need to consider sessions. A session is a half day, so and different, and it's very specific, I think, for GPs. We use it all the time rather than actually numbers, because one GP might work 2 days a week, another GP might work 4 or 5. And we also need to recognise there's a difference between salaried, locum and partnership roles. At the moment, there's lots of financial pressures, so there is a lot of review going on within the practices, so we might know more about vacancies in the future. And also we need to consider that there's an increase in list size at the moment. A lot of the lists have gone up between up to about 3.5% over the last 2 years. So what we've been able to do is look at specific data. Yesterday on the standard where jobs get advertised, there were adverts for 3 GPs, 2 salaried, 1 partner, and this ranged from 2 sessions, so that's 1 day a week up to 8 sessions. We need to be aware that we have got an ongoing scheme at the moment, which is Career Starts, which gives particularly young GPs sort of their first stepping stone, and it's a combination of being in general practice with other specialist interests. And we have no current GPs in that scheme at the moment, but we have got 3 that are really interested. From what we can look at is we have our sustainability service, which I mentioned at the development session, and that's actually out at the moment, so we haven't got any of this year's data regarding that. So the one from February 2024 showed that we had 7 GP practices with vacancies, and this affected their GP workload, with the lowest of about 12% of their workload, and unfortunately the highest about 42% of their workload or their sessions being vacant. We did then have, and there's comes with that report is a predicted what they expect people might be leaving over the next 2 years, and we had 11 practices who may have someone that they predict leaving over the next 2 years. We're also and that results in a rate of sort of 12% of their GP workforce up to 50% of their GP workforce. We also have an interim health check that we look at, and so that was done in August 2024, and that showed that there were 7 practices that still had problems with vacancies in their recruitment, and of those, 2 practices had issues that had resolved since the earlier, and 2 that had developed issues in that 6 months period. And just a quick update of what the health and social care the primary care team are doing is we're really part of the sort of workforce planning steering report, and that's being developed at the moment with for the health and social care partnership. I've mentioned previously that we do have a GP sustainability group which looks at a sustainability action plan to how we can promote recruitment and making practices more sustainable. And actually what we're working on the moment is a suite of practice indicators, which we're hoping will give us an early warning sign when practices are struggling, particularly in areas such as recruitment. Thanks.
Okay, thank you. Mr. Black.
Thanks for that, Tom. In our level of risk, if we're unaware sometimes of how much or how many people that were short, how adaptable are we going to be on that level of risk? It just seems to be, it fluctuates daily by what you're saying.
I think it's really difficult because I think it comes back to the independent contractor status, because the level of risk is actually held within the partners of a practice, and they're the ones who will make decisions around the workforce that they feel best supports their community within the financial constraints that practice has. So although we can help support them as much as possible, it's really hard for us we can't really tell them what they can do. I mean, certainly GP sustainable is, I've seen it on a lot of the risk registers, and there's a high level of awareness even up at board level of that as a risk for primary care throughout Tayside.
It may well be that we need to look at the contract with the independent contractors to actually add something in it. They should be providing that information.
Unfortunately, that's with, well, the contract's national standard. So until it came to Scottish Government. We do support practices to give us that information, and our practices are really good. We've had a 100% success rate in filling things in, such as the sustainability survey that gives us that information, which is 6 monthly. And unfortunately, I think we would struggle to support practice to be able to do it longer than that, as in do it every month or anything like that, because of the work that's involved in producing these figures. But as I said, we have got practice indicators which we hope will give us an early warning sign, and we've also got really good relationships with our practices, so actually often they do come to us saying this is happening. We engage with our clusters, which are our GP sort of representations from GP practices, and they're actually really good at discussing where the points and the concerns are if they come up within these sustainability surveys. But they happen twice a month. There's one out at the minute that should end soon.
Okay, if there's no more questions on that point, thank you very much for the update, Dr. Peterson. The next item on the agenda is a membership update. I don't think we have any updates to the membership other than the introductions I made at the start. So we'll move straight on to the Chief Officer's strategic update, which will be verbal.
Thank you very much, Chair. I'd just like to address a small number of key strategic updates since the IJB last met on the 11th of December. The first relates to the statement made in Parliament on the 23rd of January in relation to, by Ms Todd, Minister for Social Care and Wellbeing, relating to the National Care Service Bill. It was indicated in that statement that part 1 of the bill would not proceed to stage 2 of the process, and that parts 2 and 3 of the bill would proceed as planned. So part 1 of the bill is the part that deals with structural change. So the statement acknowledged that integrated joint boards in Scotland will continue to plan for and oversee community health and care services, with consideration being given to changes in secondary legislation to improve the voice of lived experience and financial transparency were her words. The Minister was unambiguous in her statement that the case for reform remained, and that change would be achieved without legislative reform. Those aspects that will continue to proceed that are of note are Anne's Law, which is the rights to visits in care homes, single electronic records, consistent information standards, and rights to breaks for unpaid carers, and the National Social Work Agency, although that was originally in part 1 of the bill. The Minister stated that it was her intention to put in place enhanced national support and oversight through a national advisory board, including representation from local government, and that would be in place by the end of March 2025. The intention was to appoint an independent chair with experience of care to hold account and monitor existing work, such as Getting It Right for Everyone, dementia strategy, and other national programmes, and how plans can be taken forward to deliver for those people with higher levels of need. So that statement was in January, and I know there's been progress in terms of appointing an interim chair for that National Advisory Board, but that's the latest update that I have. I'd also like just to say that and highlight the work of staff across the Health and Social Care Partnership in response to Storm Éowyn, which was the biggest storm that we've seen locally in over 20 years, making it what was hailed as a once in a generation event over a Friday into Saturday and further into Sunday, with many residents in Perth and Kinross losing power. So the local incident and regional incident management teams were stood up and business continuity plans invoked. And and we worked with resilience partners to ensure that our vulnerable citizens were attended to. So I'd like to pay tribute to all our staff and managers, and Jane Menzies, who held fort because she was on lead on call that weekend, our first time on call in Perth and Kinross, and that happened to be Sturm Eowyn. So I think we need to pay tribute to you, Jane, but particularly to the work of our community alarm team, our care at home staff, and community nursing services who attended to our vulnerable citizens over the weekend. The response was outstanding and should be commended. So those are the two items that I would just like to note as part of that strategic update. Thank you, Chair.
Okay, thank you, Chief Officer. Are there any questions on the strategic update? Not seeing any. Just check online. No. Okay. So the next item on the agenda is the Tayside Mental Health and Learning Disability Services strategic update. Chief Officer, you again.
Thank you very much, Chair. This meeting is a verbal update because there's an update to all of our meetings. There was a detailed written progress report received in December 24, and a further detailed update will be received in June at the IGB meeting on the 4th of June. The Programme Board for Mental Health and Learning Disability Change Programme has met twice since the IGB met in January and March. In January, the board received updates from the work streams with a specific focus on personality disorder and substance misuse, patient safety and collaborative conversations. And there was also a presentation on a draft video to support the engagement around the development of the model of care led by Dr. Peter Lefebvre. The Care and Share Together group, which you've heard about before, presented on their work to support continuous participation and engagement of people with lived experience. And that work is being supported by the community engagement team within Perth and Kinross Health and Social Care Partnership. And I would propose at the update in June that the IGB should receive a presentation on that work, because it's really helpful to see the work that they've been doing and taking ownership of participation and engagement. At that point, inpatient redesign was noted to be on track, and removing barriers to community mental health support was noted to be in progress but behind schedule. So the two key areas were identified as needing a refresh relating to learning disabilities and the coming home ambitions, and delivering on the financial framework. And at our latest programme board meeting, proposals were shared for a refresh and targeting additional resource in those areas, and that will include additional staffing resource and project support, because there's opportunities have arisen as a result of some of the programme team moving on into new and promoted roles. So we took the opportunity to have a discussion around aligning support to the programme needs as it is currently and what's anticipated in 25-26. So the and one of those areas is the two key areas around learning disabilities, and some of the work that was identified at the VRA events and workshops on design thinking, and also to appoint additional resource in relation to the development of the financial framework over the next 6 months or so. Thank you. Happy to take any questions.
Sorry, I wasn't here for that, but I just wondered if there was any mention or any progress in the general adult mental health inpatient services.
Thanks, Maureen. In relation to that, the model of care, there was a presentation at the programme board around that, and the model of care is still under development. So we're now into an engagement phase with that, I think concluding just before the summer. So that will inform decisions around inpatient mental health services, but that's not concluded yet.
Would that include the relocation of general adult inpatient services?
I think that the whole system change programme has as an action within it to identify the future resources required for that and what that would look like in terms of a footprint for inpatient services. But so that will be brought forward, and the deadline for that and the timeline that we're working to is 2026. That's in the original plan.
Okay, thank you. I'm not seeing any further questions on inpatient mental health and learning disability. So we'll proceed to the next item on the agenda, which is discharge and an update on discharge without delay. And Jackie, if I recall correctly, you're going to introduce this one? No, Zoe Robertson, Head of Health for Older People.
Thanks. Thank you, Chair. Okay, so the purpose of this report is to provide an update on the implementation of Discharge Without Delay programme, improvements in delayed discharges and plans for continuous improvement to support capacity and flow across services. So to make the improvements necessary in improving our delayed discharge numbers, it's been vital that firstly we take a whole system approach, so inclusive of all partners, including our third and independent sector. We have to date, in an attempt at working around the issues that present in relation to delayed discharge, targeted pinch points and made improvements to individual areas of delivery. And although relatively effective in the short term, a more strategic approach to transformation and whole system improvement was required to achieve long-term sustainable improvement. There are 3 particularly relevant transformation programmes that support the work discussed in the paper, and they are in and around our rehab bed programme, our care at home transformation programme and integrated locality team programme of work. There are a number of interdependencies and redesign activities that are essential and must occur simultaneously in relation to both of these programmes. And amongst these dependencies is the redesign of hospital discharge service and the capacity and remit of our day ward and our community hospitals. In relation to discharge without delay specifically, alongside the significant level of Perth and Kinross transformational work, we're working closely with our Tayside partners in the piloting and delivery of Discharge Without Delay programme. This programme was launched in late 24 and originally was a collaborative between Tayside, Fife and Lanarkshire. And it has 4 key areas of delivery in and around planned date of discharge and integrated discharge hubs, discharge to assess, frailty at the front door, community hospital and step-down rehabilitation units. Perth and Kinross were the first health and social care partnership to undertake a discharge without delay needs assessment in December 24, and this identified good progress in implementing DWD, with 22% of principles implemented fully and 76% partially implemented, with 3 not in place at all. You'll see in the appendix the Discharge Without Delay action plan is there, and you'll be able to see the progress we've made and the areas of improvement still to be achieved as we move forward over the course of 2025. When we're looking at our local performance in a national context, in May 2024, the national target for delayed discharges was set by the Cabinet Secretary for Health at below 34.6 per 100,000 of our population. This has been met consistently within Perth and Kinross Health and Social Care Partnership, performing below the Scotland positioned and our pre-pandemic average. Perth and Kinross Health and Social Care Partnerships performing well against national comparators, and there's a high degree of confidence nationally in our performance across Tayside. So in terms of our local improvement actions, there are a range of improvement actions that have been implemented since August 2024 and which have supported the discharge process more effectively. Some of these actions will lead to long-term change, and some have been necessary to address known gaps in service provision within both Perth Royal Infirmary and within community services. To evidence the resilience in the system, if you look in table 3 in the paper, I think it's particularly pertinent. When you look at the Perth Royal Infirmary emergency medical admissions and the average nightly occupied beds in January of this year, they peaked, I think, about 136, yet our DDs continued to go down. So that was really testing our resilience within the system to manage demand at the most difficult time of the year during winter, which was testament, we feel, to the actions that we have begun to implement and continue to do so. So as we move forward, we'll continue the improvements achieved through a range of developments, including, for example, the implementation of our new care at home contract. That was developed in collaboration with providers and users an alliance methodology and represented a major change in how external care at home providers are commissioned and improves relationships, joint working, and has radically reduced our unmet need. Through circumstance rather than design, our internal care at home services have in recent years delivered a very multifunctional approach to their work. This is in the process of change and full transition will be achieved imminently, with Heart Plus becoming a heart discharge to assess team and will be based in Perth Royal Infirmary and in our 2 rural localities. The discharge to assess approach means that people will be assessed at home and not delayed in an inpatient setting any longer than necessary. Heart will continue to provide an end-of-life service and long-term care at home in our extreme rural areas where we will persistently have that issue. The hospital discharge team will adopt a stronger community focus and work within the discharge without delay framework, accommodating both clinical and community-based assessments. Discharge to assess coordinators will be introduced from a multi-professional background and will access our Mosaic system to ensure that connectivity and integrated working across the hospital and community teams can be better achieved. And we'll seek to ensure the right skills are aligned to the right roles and maximising the range of specialisms that we have available to us. And we'll continue to explore IT tech and systems that can better support assessment, discharges and care and support. Alongside this work, or the culmination of this work, has meant that we've achieved a downward trend in delayed discharges, managed delays during winter, and reduced unmet need in our community by in the region of 700 to 800 hours since August 2024. The level of change and improvement is immensely positive and demonstrates our ability to meet the needs of our ageing demographic through transformation and whole system working. These improvements, particularly within care at home, have come at an additional cost of £764,000. This has been supported by Perth and Kinross Council investment in care at home efficiency transformation during 24-25. We feel it is likely the cost will plateau as our unmet need numbers reduce. We're now at a very low level of unmet need. And as we further develop our new models of delivery, we are confident that more efficiencies will be achieved, and we will continue to monitor this situation and seek to control further spend beyond our budget allocation. So in conclusion, this report has set out the positive advances that have been made by Perth and Kinross Health and Social Care Partnership in implementing Discharge Without Delay programme and in securing very positive improvements in delayed discharges, achieving and exceeding both national and local targets. The whole system improvement set out in this report is an example of the advances in the ways that we are working and improving experiences and outcomes as a result of greater integration within our structures. There are ongoing plans for continuous improvement to support capacity and flow across our inpatient services, rehabilitation and community settings through a whole system approach to discharge and removal of any historical silo-based practices. To fully enable this shift, there are key dependencies such as strong and consistent relationships, IT system sharing, co-location of key staff and services, cultural development to support staff to embrace change and to be at the forefront of transformative approaches. The report recommends, therefore, that you at the IGB note the progress to date and agrees that ongoing reporting on discharge without delay and delayed discharge performance will be reported through the IGB Audit and Performance Committee via a refreshed performance framework, which is due for approval at the IGB meeting in June 2025.
Okay, thank you. Are there any questions on the report? And if anybody online wants to put a Q in the chat, I don't think you can raise your hands, but if anybody wants to just put a Q in the chat to come in, we'll go to Dr. Peterson first.
Mine was just a quick query about the IT and the systems, I see day to day the real benefit of integration and seeing it really develop. I just wonder how we engage issues around the IT systems that our individual services use. We have 3 different systems, one's kind of being updated in primary care at the moment. We've got Mosaic coming in, we've got Morse coming in, and none of them actually talk to each other. And I'm just wondering about how we engage these discussions wider, because I suspect those decisions are not made often in the health and social care partnership, but these feel fundamental to us actually being fully integrated as teams to be able to share that information. And I don't know how we ensure that happens.
And just when you come in there, so Mosaic is the new social work system, but maybe you could just cover what Morse is.
Morse isn't my bag, but Mosaic's my bag. But I mean, I suppose the point I'm making there about using Mosaic within HCT is for what is one thing that we can control in there, and we weren't doing that. And one of the issues in terms of some of that work is the delay in process because of the clunkiness of the systems, and not even the clunkiness of the systems, using emails to communicate, to transfer information. So really quite old-fashioned in actual fact. So Mosaic is a first step for us in terms of making that a more integrated recording system. And we work very closely with our partners in Dundee at their hospital discharge team, and they are already using that as a system. So that's one that we can kind of quite easily tick a box on. But you're absolutely right, in terms of transformational progress, we have to be able to overcome the multitude of systems that we use and find some sort of uniformity in order to really achieve the optimum that we can.
What's Morse, Dr. Peterson?
So my understanding is Morse is the new system that our community medical staff are converting to. So we're now going to have 3. We've got some, I see some brilliant development of integrated teams, but within that integrated teams, we're using 3 different IT systems, which in itself has challenges for information being transferred about patients.
Thank you very much. I think it's on this point. I don't have the answers to that, but I think it was really just to ensure that the IJB and members here are cited on the fact that NHS Tayside will be proposing support for transformation and it's some funding there. The work that Zoe's been outlining in this paper has to be central to that. The digital advancement of that has to be central to it. And also, we're not on the finance paper yet, but Perth and Kinross Council has set its budget, and within that has allocated a certain amount to transformation and developments in social care. And I think the discussions that we've been having within the Health and Social Care Partnership is the importance of digital advancement that you're talking about. So I think there's something here that we don't have the answers yet, but I think there are opportunities that arise from that we need to, in all of our conversations, not just here, but it has to be a whole system conversation across Tayside, because if we have two of the health and social care partnerships using the same social care database and management system, etc., there are opportunities I think we need to embrace over the next year or so.
Thank you. Dr. Doyle.
So I guess mine is more of a positive point, just really to congratulate you on all the work that you've done. I see firsthand the evidence of this working across the system, whether it's in PRI or whether it's in Ninewells. The number of medical diverts you could imagine would be phenomenally increased. I know we've had some over the winter, but imagine where we would be if you'd not done this work. And for the people of Perth and Kinross, keeping them in the hospital that's local to them makes a massive difference, particularly for our elderly population, to visit them locally rather than having to come all the way down the A90. So I think, massive congratulations to the team for the work that's been done and what you've achieved there. I think in Tayside, across Tayside and our 3 IJBs, we always try to achieve better than what we're asked to do. So this 37 per 100,000 we've said isn't good enough. We know it's not good enough to keep our system flowing and working with the amount of increased demand that's coming in. And by achieving better than what's been asked of us, we make it much better for our population. So I think just a well done.
Thanks, Dr. Doyle, and I'm sure that thanks will be taken back to the whole team. As you say, that's a very positive story. Mr. Blacksnake.
Thank Joey for that. And it's actually a carry on for the three different systems that are in place, like in an integrated service, kind of what she says. Baffles me. But the AI tool that we're going to try to bring in, will that be a one-off for across three services, or will we be going down three AI tools for different services? That's my first part, and the second part, just a quick update. How is guardianship and POA still making a big impact in discharge?
Yeah, I mean, I nearly mentioned it earlier and then I didn't, because AI is, I think, is something that we could really capitalise on the use of. And we've been looking at one specific tool, and there are a range of providers that can provide that, and what we're seeking to do is implement a test of change. And I would always say that if that test of change is successful, then it should be applicable across the three areas, and we should be able to share the learning from that. My understanding is that Dundee have used it in one of their other areas, not our specific area of delivery, and that has worked well. But I suppose it's early days in terms of some of that work and what organisation or what tool we would use for that, and procurement opportunities, and potentially Tayside-wide procurement opportunities in there in terms of some sensible funding decisions in and around how we would support that. Regards the POA side of things, am I okay to hand over to you, Jane, for that one?
I would probably have to I would probably have to look at that and give you more detail, if that's okay, in terms of, yeah, rather than just sort of second guess it right now. But
it's always been guardianship and power of attorney. It's always been a big hold up in discharge since Moses went in his basket, like, and it's no doesn't seem to be getting much better.
yeah, it does remain an issue, but the extent of that, I'll get the details and provide them to you.
And I still, when I said at that development day, there's an opportunity here. You've got world leading people who use AI in the gaming industry in Dundee. So while there's no any a partnership or any working or any engagement with them, it baffles me.
I think, do just to give you some figures, Martin, because I happen to have we've got a dashboard around our delayed discharges that we look at every week. In terms of, you were asking about POA, which I'm assuming it's about adults with incapacity, and although we don't have huge numbers around that, one of the key issues we do have is around psychiatry of old age. So it's not necessarily around adults with incapacity and the inability to discharge without the power to do that. It's more about finding the most appropriate care resource for people with complex needs. So, and at any one time, I would suggest we probably have about a third of our, just under a third of our delayed discharges are associated with that, primarily the wards that we operate at Murray Royal Hospital. So it is a significant issue for us, and it's something that we're looking to address in terms of the transformation around that, particularly around dementia.
Mrs. Summer.
I had an experience in hospital this week where I was admitted on Tuesday and discharged last night. And it's not really a delayed discharge, but for the patient, it is a delay when the doctor tells you at 11 o'clock in the morning you can go home, and you don't go home until 5 o'clock that night, you know. And the reason was because the pharmacy, well, I was prescribed a new medication, and I thought that's all that had to be done. But it turned out they gave me a month's supply of all the medications I had, which wasn't really necessary because I had all that at home, and I told them I had everything. But I don't wonder, is that a policy that they discharge you with a whole load of medication that you already have? And that was the cause. I mean, it's hardly a delayed discharge, but it's an annoyance to the patient, like, you know. So.
Dr. Doyle, do you want to come in on that?
Yeah, I'll try to help with that. It isn't a policy. It's not policy. Sometimes it's due to inexperience of staff. It's difficult without knowing the exact situation, but quite often what we're trying to do is, if somebody's got medication at home, you're not replacing that medication, you're just adding in the new additional medication. Probably if we could maybe get a wee bit of feedback about that, we can feed back to the individuals concerned and make sure that that doesn't happen again. Because, you know, for an individual concerned, you know, it is 6 hours sitting there when you could be somewhere else. And at busier times in the system, that also has a knock-on effect to new patients coming in. You know, they might be sitting in a corridor or whatever, not able to get into a bed. So, yeah, there's certainly feedback we can do.
Thank you. And Dr. Illingworth, Councillor Illingworth.
Great, thank you, Chair. So it's a great report, thank you. There's lots of greens and quite a lot of oranges and a red. What's your sort of timescales for getting them all to green? Is that a brave statement? Good, right, thanks.
The current Discharge Without Delay programme, we are aiming to achieve the range of improvements that we have committed to by the end of 2025 at the moment. So.
Hunter.
Zoe, thank you for the report. Well done. I think that was well done with what the work you've done with the team and everything. It's just on the last paragraph of your report with the key dependencies, and it's the co-location of key staff and cultural development to embrace change. That's where the conversation we had yesterday, Jane, myself and Jackie, would be very helpful, and that's where we would definitely be wanting to be part of the co-locations, which you already are doing, I'll give you that, and any cultural changes that you're wanting us to have staff engagement with NHS. Obviously, that would be NHS staff I would be engaging with, but I'm quite sure Stuart Hope, which I've seen on screen, would probably want to do that with council. So it's just to make us be aware of what's happening, when it's happening, and to keep our line of communication open the way it is. And Mrs. Summers, I cannot believe you're here. I cannot believe you're here. Well done, fair play to you. Sorry.
Okay, thank you. I'm not seeing any further questions or requests for comment on the report. Just once again, thank you, Zoe, for an excellent report. Very encouraging, and I think to echo the praise from Dr. Doyle and Ms. Hunter, and if as I said before, if you take that back to the team, can we note the progress to date and agree that ongoing reporting on discharge without delay and delayed discharge performance will be reported to the Audit and Performance Committee via a refreshed performance framework, which we will approve at our next meeting in June 2025. Agreed. Thank you very much. We'll move on to the next item on the agenda, which is an update from the strategic planning group, and I think it's Jackie and Jane who are going to give this. Chief Officer.
Yes, thank you very much, Chair. I don't often give the update on this, but the last meeting of the Strategic Planning Group was last week, and I chaired the meeting. We met on the 11th of March, and there were 3 very important agenda items, all of which will be coming and making their way to the IJB. And I think it's helpful to note that our intention to ensure that there was sufficient pre-engagement, if you like, with the strategic planning group in advance of reports coming to the IJB is something that seems to be working well and better in terms of the scheduling of that, because the 3 items, or certainly 2 of them, will be on our agenda for June. The 2 that the IJB will be hearing and receiving final reports in June relate to the final update on the Autism and Learning Disability Strategic Delivery Plan 22 to 25, and some thoughts about how that will be further developed going forward from 25 to 27 or 28 going forward. It was within the discussion that we had there that we the issue that I mentioned earlier about engaging in a much more wider workshop with a wider range of stakeholders about that whole age issue, if you like, or importance of considering, particularly around the neurodevelopmental pathway from for children, young people, and into adulthood, and those transitions around that. So that was a real key point of discussion and an action that we've taken forward. And we also had a presentation and discussion facilitated by Jane around the community mental health and wellbeing strategy that Chris Lamont has led for us since 2022, and some thoughts about what that will look like going forward from 25 onwards, thinking about the implementation of the new model of care within the Perth and Kinross context within the communities. I don't know if Jane wants to say something about that.
Yeah, thank you. So so it was just that, it was sharing some ideas about what the next iteration of the strategy would look like. And it was a really valuable discussion, but it was centered around a number of key principles. One was to establish a tiered approach to community mental health care as we move forward, predicated on the principles of prevention and early intervention. So our core aim is about providing support or care to individuals at the earliest opportunity to prevent them, where possible, from escalating into clinical services. So in order to do that, we'll be looking to work very closely with our primary care colleagues to support the volume of work that they're dealing with as well. We are also looking to bring together the work streams of mental health services, but also drug and addiction services. I beg drug and alcohol services, I beg your pardon. And that's because they can coexist, and it means that people don't receive the seamless service that they should. So where appropriate, we're looking to bring that together. A key development for us, going back to the points made earlier about services, is the establishment of a single point of access as well. So to really simplify the referral pathways, to ensure that people are in receipt of the care they need at the right time by the right organisation. And that allows us to gain more evidence as we move forwards into the sort of population needs of Perth and Kinross. So in the future, we can think about where we need to place our resources. And finally, which Jackie alluded to earlier, is a specific piece of work in partnership with Dr. Gillings, who is leading on work for emotionally unstable personality disorder. And this tends to be quite a unique group of individuals who can really challenge us as services to ensure that we can provide the right response for them. So this is based on a multi-agency response where we look at sort of shared decision making and shared risk and coordinated care to improve some of that. So that will be interesting to inform the IJB as we move forward. So our aim is to have the strategy at this meeting by the end of the year, but the next comprehensive report would be in June.
Okay, thank you. Are there any other questions? Oh, sorry, any questions on the strategic planning group update? No. Okay, we'll move on to, thank you very much for the update, Jackie and Jane. We'll move on to the next item then, which is the the latest update on the 2024-25 financial position. We've moved into the finance section of the agenda. I wouldn't normally break this up, but just to give a wee indication that depending on the time, I might take a break after this item and before we discuss the budget. I think it'll depend how long we take for this item, but hand over now to our Chief Finance Officer, Donna Mitchell, for the update on the finance position.
Thank you, Chair. Good afternoon, everyone. We've had some discussion about finance already in previous papers, which is good to hear. But this report we've got in front of you today represents the latest financial position, and that's based on expenditure to the end of December. So that's the month 9 position that we're looking at today. And based on that expenditure to date, this report then provides a forecast for us to forecasting to the end of this financial year. It's important to note that when setting the budget for this year, the IGB anticipated a difficult year financially, and it anticipated that an increased level of financial control, savings and reserves would be required for the IGB to balance. And despite overall positive delivery on savings, which you can see contained within the report, together with increased financial recovery measures and greater use of reserves, that this latest forecast does indicate a year-end overspend of 1,360,000. This does represent a minimal movement from what you've seen in the last report at the IGB, and it equates to about 0.5% of the budget. Although there are several over and underspends and movements and variances across the services, the main driver of the overspend above plan remains to be within drug costs and prescribing, as well as care packages and placements within adult services. Focusing on the drug costs and prescribing, and as noted in the table within section 3.17 of your report, the IGB's budget recognised a particularly challenging year for the prescribing budget, and this was due to an insufficient budget. In addition to that, no uplift for this financial year, and together with increasing costs. So the IGB approved additional funding, and it approved an ambitious savings plan to reduce the shortfall to just over £1 million. However, although there have been success and great success in the local switch programme and a lot of engagement from our GPs, there is an under-delivery on savings plans overall, and that's resulted in a shortfall, and therefore we're now projecting to be £2.2 million. On a positive note, I would like to highlight that £5.5 million of savings were approved to be delivered in 1 year. And with the exception of the prescribing related savings that we've just discussed, all have been delivered in full. And I would like to thank, or take this opportunity to thank the services that have helped to deliver these, and recognise that these services and teams are still adapting to accommodate those changes. I would also like to give thanks to the services that have been working closely with the finance team to deliver the financial recovery actions in full. So although we approach the end of the financial year, there are still some risks that could change our financial position, and they're detailed in section 7.3 of your report. And I would like to highlight inpatient mental health and section 6 of the report, where the IGB is recommended to delegate authority to finalise an agreement regarding inpatient mental health overspend for 24-25. But in conclusion, we are pleased to report no further deterioration from the last report to the IGB. However, an overall year-end overspend of just over 1.3 million does remain forecast. Happy to take any questions.
Okay. Questions or comments on the financial position? Not seeing any. Oh, question online. Sorry. Oh, Councillor Illingworth.
Right. Two questions back, if I can. What's the current position with 2C practices? Because we're used to pay. Has that been resolved?
Thank you, Councillor Illingworth. It's actually referred to in section 3.20 onwards in the report. Discussions are ongoing. This has been a concerted effort to take this forward this year, although we appreciate we've discussed this over a number of years. There has been a particular effort this year to take this forward. And there are meetings being held across Tayside with the finance team and with senior primary care colleagues and leads, which aim to give a further understanding of the breakdown of the budgets. We're looking at the current commitment and the issues facing the overall budget, of which 2C is a part of. So we are looking at a wider view of changing the not only the financial risk share but the risk share across those budgets. But for 2C in particular, I would refer you to 3.22 of the report, where it's been agreed that the Perth and Kinross IGB will no longer receive a share of the Abbey 2C practice, which is in Angus, and therefore the exposure to 2C overspends that are being incurred in Dundee and Angus is capped this financial year, and that's been fed into the financial position that you see. But I do want to give assurance that we are taking forward for a more sustainable solution or a transparency around the budget that we have within General Medical Services.
Question. You've talked about risks. Do you have any contingency plan for if these risks come to play?
So appreciating the stage of the financial year that we are in, we do the risks are minimised because we're obviously already in March and we've continued with our month 10 and our month 11 position, so we're aware of changes that will have happened over those 2 months. The areas that we've highlighted within here are the things that really can change it. So prescribing always sits as a risk, and we have to think about what we can do, controllable and uncontrollable. We have had a slight heads up that it's changed for the better over month 10 and 11, so there's some hope there. Zoe Robertson's given us an update on what's happening around care at home, so we're able to in some way control that level of need that's coming through and how we're meeting that need. And within inpatient mental health, Jackie's talked about it, and she's talked about the progress with the financial framework. We are aware of the overspend that is sitting there being forecast at the moment, and we don't have any indication that would reduce significantly. So that is still sitting as an outstanding risk, but the financial risk share has not yet been agreed for us to take forward. That would happen for this year end. So I guess overall, we're feeling quite confident that our risks are minimal, but we are certainly on the thing that we can control, taking as much measures as we can. And I would say that on the financial recovery section in the report, although we are presenting that that's going to be delivered in full, just because it's delivered in full doesn't mean we're stopping with the actions that we're taking. They are continuing, and when we do move on to the next paper, I would give assurance that those that I've seen as positive practice throughout the financial recovery that we've started this year will continue going forward because of the situation, the financial situation we're in.
Dr. Dawn.
Maybe more for my understanding. When you speak about prescribing here, is this in the context of all people, age 0 to whatever age, or is it only in the adult population over the age of 18?
So all prescribing.
So I guess on that point, there is some positive news in that we are interviewing next week for a pharmacist to create the paediatric formulary. Most of those savings will be realised in primary care rather than in secondary. So there was we all put in, I think, the 3 partnerships and then acute all put in. We've really struggled to identify somebody for that role. It's had to go out 2 or 3 times. But yeah, we're interviewing next week or the week I think it's the first week in April actually. So hopefully into the next year, then there will be savings around about that. We're trying to identify the biggest hitters, the things that will cause the biggest savings. So melatonin, for example, by getting that into a formulary and getting, procuring that across the patch will then realise some savings.
I was just going to say thank you for that addition, certainly for this paper and for the paper we're going on to. That's really helpful update.
Yep, thanks, Dr. Doyle. Can't wait. Ms. Hunter, I think you were next.
Hi Donna, it's in regards to the financial recovery, and I'm going to say vacancy control again. It's just to say that after you provided a report for the Health and Social Care Partnership Forum, and there was a lot of questions around vacancies. Staff side like their vacancies and we like to know why and everything. And it's very welcoming now that we are part of the vacancy scrutiny group, myself and my colleagues, because it gives us that context and gives us that narrative as to why they're either being not held. I don't want to use the wrong language, and I'm trying my best not to, but there are different reasons why, if it's cost redeployment or other things, of why we're doing what we're doing with vacancies. And it does really give us that whole picture. So I'd welcome that we are continued to be on the scrutiny group, because it does, and it will help with any other future questions we have in regards to finances when it comes to vacancies in the NHST side within the Health and Social Care Partnership. Sorry.
Thank you very much, Lindsay, because I think there's something just to note in here, that we're presenting this paper, but there's actually staff and managers across the whole Health and Social Care Partnership that are actually delivering on that, and the attention to detail around preserving what we know we need to have in terms of those frontline activities and professional roles that we need, but also at the same time thinking about how can we do things differently at all levels. So your engagement in that's welcome, but I think we need to just note the contribution of staff across the Health and Social Care Partnership in delivering that within the year, because it's been actually quite a significant achievement actually.
Thank you. And Mr. Black, you were next.
Sure, you've told me this before, Donna. Just questioning on 6.2. There's no budget delegated to the IGBs for 24-25. So we have a strategic responsibility for mental health. But there's one IGB has the mental health strategy overall. Huh?
So the position is that NHST side is operationally responsible, but the 3 IJBs are strategically responsible for inpatient mental health. But within that, Jackie, as the Chief Officer of this IJB, is the strategic lead. I think that's correct. I'm getting nods, so I've got that one right. Okay, are there any more questions? Mr. Singh.
Thank you, Chair. I suppose it's just really to recognise the tremendous work that the Health and Social Care Partnership senior management team have actually undertaken. It's been a really difficult year from a financial position, which is clearly detailed within the report, but having really early insight and the ability to be able to take corrective action, I suppose, have actually put us in quite, it doesn't feel like a good position, but a better position than what would otherwise have materialised. And what I'm seeing throughout the report is that we have continued to retain our focus on those who are most in need, which clearly has to be where our priority lies, but that doesn't come without cost. And I just wanted, I suppose, recognise and put it on the table to thank yourselves in terms of the dedication and support that you've given not only to the patients, service users, but also to the workforce as well. So thank you for that.
Okay, and I think as well, reflecting on the point you were making, Mr. Singh, about being in a much better position than we might otherwise have been, looking across the board, across Scotland, there are health and social care partnerships facing real challenges, and I think it's clearly a huge amount of work has gone into stabilising that financial position. So thanks from the board. Mrs. Summers.
The 0.11. Community mental health teams across P&K are forecasting an underspend of 0.654 million, but they say that was due to delays in recruitment, and there have been successful recruitments to several posts. It doesn't say I meant just several posts. Will that impact, does that mean they'll go into overspend, or will the posts that they've recruited be within the 0.654 million underspend?
Thank you, Maureen. Well, it's a very good point. I would just give you the reassurance that the £654,000 underspend is a projected underspend. So the finance team and the service will have taken on board that information that they had about new people starting before they made that projection. So it'll allow for the new posts coming in. Yeah. Yeah. Yeah.
Okay. Not seeing any further questions. Okay, thank you very much, Donna, for the report. Can we agree that to note the overall forecast outturn for 24-25 based on financial performance to the end of 24? Note the Chief Officer and Senior Management team have continued to work on and review actions to mitigate cost measures. Note the update on the financial recovery plan in Section 4, and note the financial risks as detailed in Section 7. Agreed. Thank you very much. Okay, I think we've been at it for an hour and 20 minutes now. I think we might spend a little bit of time on the next item on the agenda, which is the budget, and therefore I would propose that we take a 10-minute break to stretch legs and get some respite from screens. So resuming at 2:30. So we'll now proceed to item 8.2 on the agenda, which is the 2025 to 28 budget. This is another report by our Chief Financial Officer.
Thank you. I'm pleased to present this report to the board today, recommending the board's approval of the 25-26 budget and noting the provisional budget for 26-27 and year 27-28. It's been certainly no news to this board that health and social care and IGBs nationally are facing unprecedented levels of financial pressure. The Accounts Commission has published 2 reports on IGBs and on health and social care this year, one in July and one just earlier this month. And they're highlighting that it's never been more challenging for IGBs in setting a budget. They have urged IGBs to work closely with NHS and council partners to identify necessary savings to set balanced budgets for 25-26. And this message mirrors the Audit Scotland recommendation to this IGB as part of the annual accounts audit, recommending that the IGB works with partners to deliver financially sustainable services and that additional funding would be required. So this has been the approach of this IGB and officers, and that's the approach that they've taken in preparing this budget and will require to continue doing so at pace for future years. I would like to take this opportunity to thank Perth and Kinross Council elected members and its leadership team, NHS Tayside Finance and Leadership Team, and all the IGB members for your commitment and your willingness given over the last few months. It's been truly, the commitment and willingness that you've given has been truly to understand not only the national picture, but most importantly, the local challenges that we face, the areas that are working well and the areas that require change. And this is one of the reasons that I, and I hope others, feel fortunate to work for and within this partnership. And I mean that in the widest sense, and feel fortunate to be a part of this IGB. Both the Council and NHS Tayside are facing significant financial challenges, but their commitment to caring for and protecting our most vulnerable citizens in Perth and Kinross has led to an increase in the IGB's recurrent budget. The increase in budget has significantly improved our ability to protect and maintain essential health and care services. However, this is allowing us to maintain the level of service, but it does not allow us to do more. And although this has been a substantial increase, and when considering the level of need and financial challenges that we face, it is a far more positive budget and position that I expected us to be discussing today. However, in order to achieve balance, we do still require to minimise our pressures, and we do still require to deliver on those savings that have been previously presented as part of last year's provisional budget, but that they still aim to minimise the impact on the strategic plan and minimise the impact on the population's health and care needs. Due to the increase to the budget and the proposal of savings, the IGB is presented today with a balanced budget for 25-26. As noted within the report, the budget is based on information known at this stage, and pressures are based on a mid-level scenario. Several risks do remain, and they are detailed in section 8 of your report, and these will require careful consideration and management throughout the year. The budgets for the following years, 26-27 and 27-28, are not yet balanced, and additional work is required with all stakeholders to ensure transparent, achievable and sustainable solutions are realised. The IGB's financial strategy focuses on efficiency and making the best use of resources, focuses on transformation and our commitment to continuous improvement, and only then we will look to prioritise and reduce. In preparing this budget, the Council, NHS Tayside and IGB members were keen to be informed by data and performance, ensuring that our decisions were informed and impact was assessed. And data and performance is an area that we need to and will continue to strengthen and improve to ensure all stakeholders are best informed about what decisions may mean for services and help guide us to ensure our services remain resilient and responsive to the particular needs of the Perth and Kinross population. The report and appendices, I'll move on to a bit of the detail contained within the report. The report and appendices do provide detail on the pressures, the savings and the funding. And in summary, the level of pressure is 19,773,000 across health and social care for 25-26. To meet this, the savings and budget alignments of 3,582,000 have been proposed, and funding from Scottish Government to cover uplifts for living wage and free personal and nursing care amount to 4,273,000. Perth and Kinross Council have approved a substantial increase to the IGB's recurring budget of 6,700,000, and NHS Tayside have indicated an increase of 2,100,000 to the recurring budget, and this is to reflect the growth and the change in the Perth and Kinross population. This increased budget allocation reflects our collective commitment to protecting the most vulnerable in our community. However, achieving a balanced budget will require ongoing efforts to deliver savings and manage risks effectively. Reflecting the recent findings of the Accounts Commission, it is essential that we continue to work together with all stakeholders to develop transparent, achievable and sustainable solutions for the future. And by prioritising efficiency and making the best use of our resources and continuously improving, we will strive to ensure our services remain resilient and responsive to the needs of our population. However, we need to note that this will not be easy, and the IGB and partners will need to be transparent with communities about what achieving this will mean for services and actively engage with communities about the decisions that need to be made. I would thank you. I'll stop there, and I would be happy to take any questions on the report.
Thank you very much. Looking round for any questions. Okay, so Mr. Henderson, Dave.
Thanks, Donna. So I acknowledge the challenges that setting the budget has brought everybody. Also acknowledge this maintains the level of provision across P&K, which in turn supports the independent sector in maintaining their level of workload. In discussions today and in the meetings papers, the critical role of the independent sector is evident. Reduction in delayed discharge, reduction in unmet hours, increase in care home placements, responses in storms, etc. My concern is around provider sustainability. It's touched on in 8.1 in the papers. Given the lack of financial support, particularly around employers' national insurance contributions, the impact that will have on social care providers, whether it's care homes, daycare, supported living, etc. And the impact then it will have on the people in Perth and Kinross and the HSCP in delivering services if providers are failing or ceasing business. Thanks.
Thank you, Dave. Very much appreciate that question. It also gives the opportunity to highlight the context in which we are, the budget that we're looking to set. So as I've referred to, the Accounts Commission has reported recently on the national picture, and we're aware that IGBs across Scotland will be setting their budgets over the last week and the coming weeks, and they're in varying positions. And I would say in comparison to some areas, we are presenting a budget that's relatively positive in the light of we're not having to reduce the services that that we commission at this stage significantly. And I know that that's not the situation across Scotland, and for that we're very grateful. So I would make that point. However, what that does is it allows us to protect and maintain at the level that we're at. So we've prevented from having to drop back and make cuts. And that would be great that we're at that level, had that extra pressure then not come along around employers' national insurance. So what I would say is the representative of providers, of which you're well aware, have presented, and let other members be aware of this, they've presented the impact of the increase in employer national insurance at the round table discussions with the Cabinet Secretary. And this has been presented very clearly, highlighting the significant risk to the sector and to the whole system, which is very important for the IGB members to be aware of the potential impact on the whole system. Unfortunately, there's no funding being provided to meet this additional pressure, and our budgets will not stretch to allow an increase without a reduction in the amount that we commission. The additional funding from the Council and NHST side, together with the savings that we're proposing to be delivered, is not sufficient to allow us to provide an increase in funding to offset these costs in relation to employer national insurance increases. An impact assessment is therefore required so that decisions can be made, and we will be working with providers to understand this, and there will be varying levels of impact. We're well aware of that. This is first and foremost a service risk, but it will result in a financial risk, again, that we need to be aware of. So there is still uncertainty as providers continue to meet with the government and articulate the scale of the impact that this will have on the social care sector and the whole system. And both Scottish Care and CCPS are advocating, as we understand, on behalf of the providers, as this is a national issue that requires national conversation and a national solution. Very much recognised as a risk for ourselves, Dave. Thank you.
Thanks. And I think you were explaining to me just the yesterday, Chief Finance Officer, the clarity and effectiveness of the messaging that the care sector was bringing to the discussions with the Cabinet Secretary, but also the starkness of the position. So across Scotland, if there's an £82 million cost to the care sector of that ENIC's employer national insurance contribution, the cost of not providing that would be incalculably higher. Our next question was from Ms. Hunter.
It's not a question, okay, it's more a comment. It's in regards to the 6.2 about the 35 full-time equivalent posts, 9 are still to be realised over a 2-year period going ahead. Obviously, with what I've previously said and other things within this report, it just shows the amount of change and amount of transformation that we are going to be going through as a health and social care partnership. And it's just to stress that when NHS staff are involved, the partnership working is through the middle of this, because there is going to be a lot. And I've already said this. This is a period of organisational change for a lot of areas, not just health and social care partnerships, but for NHST side, and for that to develop and for that to be a good experience for staff and adhere to staff governance and everything else, the partnership will need to be around this. So I'll welcome all the phone calls and all the meetings that will come from this report, because we are in a better position than what we were last year, I would say, because I'm not dealing with cuts, which I'm very grateful for. However, there is going to be a lot of change and a lot of different roles which will need to change and happen. So it's just to make that comment that I welcome the phone calls and the meetings that will enable this change and this budget to be realised. Thank you.
I just need to say, Lindsay, and we welcome that engagement and are committed to doing that, because it's very important that we manage this, but we manage it well, and your involvement in that's key. So thank you.
Thanks, and as well, I would say you were talking about the transformational change, recognising that it's in the wider public sector as well. Certainly, the change and the challenge that presents, from my experience as a councillor, staff rising to that challenge is really inspiring, and the adaptability that people show, particularly under trying circumstances, is really great and appreciated. Councillor Illingworth, you were next.
Thank you. In the last financial year, or this financial year, there was a cut from the Scottish Government in multidisciplinary team. Has this cut been replaced for this financial year or the new financial year?
Unfortunately not. This is the simple answer. The pressure that's brought, that cut into funding has brought, means that we've had to add that in as a pressure for this budget and find a compensating saving or compensating funding to mitigate that. So unfortunately not.
Mr. Black.
Thanks, Anna, for this report, and there must be a congratulations to you and your team to get us to where we are today, and that has to be recorded, and also to the partners for the money that they've also put in to ensure that this happens. But when I look at the assumptions of the future risks, it concerns me greatly that we're looking at $500,000 for every % on the NHS uplift on pay. But under the local government, we've not got a figure for 1%. How much would 1% cost? Then we've got a new drugs and prescribing costs, which for year upon year, they keep providing new drugs, and then they get any costs to deal with the new drugs. So that's going to impact. And then the inpatient mental health, we've not come to an agreement about the overspend, and we've got a balanced budget for this year. But you say that there's considerable gaps for 26, 27. Many wonder when we do have this information. And when is this information ever going to be forthcoming from the people who have the information and seem not do anything about it?
I could certainly answer some of that, Martin. In regards to the local government pay settlement, for every 1% that it increases above what we've allowed for in this budget, it would be a cost of 350,000. I'm just going to quickly look to Mark, so he's nodding his head. Yeah, that's correct. So we'd be exposed to 350,000 for every 1% above what we've provided for if it were to be unfunded. In regards to the new drugs and prescribing costs, very much so. We've based this on the best known circumstances that we have at this time. We've got some national guidance around what to allow for in our pressures, and we've made local decisions, and we've applied local knowledge to what we should put in there. Hamish and the prescribing team have been successful in recruiting to a pharmacist post that we can target our resources to areas that we think it's best spent. But I had referred to this being a medium level scenario, and it was something that we talked about quite extensively. Our budget review group and our development session is the level of risk that we are carrying in coming forth with a mid-level scenario. The high level scenario, and I think this is referred to in the report, could expose us up to a further 5 million. And within that are these pay potential increases and that prescribing exposure, along with levels of need that we perhaps not anticipated. So we are carrying a high level of risk, or maybe not a high level of risk, we're carrying a level of risk, but it would be most prudent for us to set this budget on a mid-level so that we're not trying to deliver on savings that are very difficult to achieve and most likely would put us against our strategic objectives, and we wouldn't be able to minimise that impact if we're not certain that they will be realised. We have met, and apologies, I was going to mention that in the introduction when we're talking about that we need to really focus on our future years now, and we have already met as a budget as a IGB development session to start looking at next year and the year after and the year after that. And the question we put to ourselves was, how do we deliver the strategic plan in this financial climate? How do we do that? And it was a really valuable discussion, but it was just the start. And we don't stop. We don't stop. We set our budget today, hopefully. Hopefully everyone recognises it's positive and appreciating the level of risks that we have still outstanding to the sector. But compared to where we may have been, this is a positive budget for us. But we don't stop. We have to continue with the work and the effort that we've been putting in to keep that momentum going, to keep that positive, rich data and performance coming forth so that we're making wise decisions. But most importantly, that we really do take on board the Accounts Commission advice, take on board Audit Scotland's advice and work collaboratively with NHS Tayside and Council and with all stakeholders to ensure that our services are going to be sustainable and that we're really prioritising, because we're not going to be able to do everything. So we have to work together, and that is something we genuinely do take forward.
And I think just to add that, continuing, looking forward to those future years, continuing the budget review process, but doing it on a continual basis rather than just doing it at the towards the end of the year before the start of the next financial year will be a key part of that process. Councillor McCall, you're next.
Thank you, and I'm pleased to agree that this should be an ongoing process. My question really is around the contribution from Perth and Kinross Council on the transformation reserve for the care at home and reablement. That really affects one part of our transformation that's required to achieve balanced budgets going forward. I'm just wondering how we anticipate we can match that somewhere else, or can we get some other matching, because that's just part of our challenge.
Thanks, Councillor McCall. I think I referenced earlier the proposal that is likely to come forward from NHS Tayside to set aside transformation funding at an NHS Tayside level. And we're already engaged in discussions about what does that mean whole system. Sheila, so I think that answers your question, Councillor McCall, that there's it would be a huge missed opportunity if we don't think about joining that up, not just across the whole system, if you like, from Perth and Kinross and into NHS Tayside, but across the 3 health and social care partnerships as well. So we're being challenged as chief officers across Dundee, Angus and here in Perth and Kinross to see what we can do, what are the key priorities that we'd want to take forward as that whole collective system.
Thank you. That's really the answer I was hoping to hear, because I think it's really important that without that joined up working between the councils and not just the Health and Social Care Partnership, the councils, the Health and Social Care Partnerships and the NHS board need to work collaboratively on the same things at the same time. So we're not all pulling in different directions at different times. So thank you very much. And I hope that our colleagues who are on the health board will be able to bring forward that message too at the board meeting at the end of the month. Thank you.
Okay, so that's all the health board members told. I'm looking round for any other questions or comments. Well, this could be the shortest budget discussion yet. Okay, if last call, Mrs. Somerset.
I've been away for quite a while, but I did hear on the news that the English government is going to be abolishing NHS England. Do you think that that'll have a knock-on effect to us, and how would that impact on us? Just wondered because it's supposed to be happening in England.
Whether there are consequentials in a sort of Barnett formula style for Scottish government funding, I don't think anybody knows yet. The proposal's just newly out, so nobody here will have an answer to that question. Sorry, it's a much wider question than we're able to.
Just wonder if we're prepared for, if it does come. I mean, are we? What would be the knock-on effect? I mean, I don't understand how they can just abolish NHS England, but what are the consequences?
So just to say that NHS England specifically is a sort of level of in between ministers and the individual health boards. So it's not the entirety, but again, with the announcement just having been made, nobody here will be prepared to answer about any consequential impacts that there'll be on health funding to the Scottish Government and on to the health and social care partnerships up here. If there are no other questions or comments, thank you very much, Chief Finance Officer, for your report. I think it's particularly heartening to see in that table 3 in section 6.5, there was certainly so the Perth and Kinross Council budget increases is very much appreciated, as you said, and the coming parity adjustment for from NHS side, the NRAC. I don't like to use these abbreviations, but I can't remember what it says, what it means. National reasons. Okay, I'm not going to try and repeat that. And the uplift from NHS in terms of both pay and non-pay costs, but I think as well the opportunity to access that transformation funding, both from the council, from NHS Tayside, and from the Scottish Government as well. There's funding from the Scottish Government available for transformation, and potentially other sources too. That'll be key in terms of actually trying to achieve those year 2 and year 3 savings and balances. Thank you very much to the finance team and all of the staff of the Health and Social Care Partnership. I know a huge amount of work went into this, but thanks as well to the board members for the very full and frank discussions and for your engagement with the budget review process, which, as I said, we're committing to keep going on a continual basis in the future. Members, can we approve the 25-26 budget as set out in Appendix 1 and the expenditure pressures set out in Appendix 2 and the savings and funding proposals set out in Appendix 2 also? And can we note the risks set out in Section 8 of the report? And can we note the 26-27 and 27-28 provisional budgets and the additional work required to bring these years into balance? And can we issue the directions as set out in Section 10 of the report? Agreed. Thank you very much. So that concludes the discussion on the budget. Next item on the agenda is an update from the Audit and Performance Committee. I'm going to pass over to the Chair of the committee, Councillor McCall.
Thank you, Chair. Since our last meeting here, we had an IGB Audit and Performance Committee meeting on the 24th of February. It was a busy agenda, and a number of the items that were on the agenda are also included in today's full IGB meeting. I mentioned before about a recovery plan dependent on the funding from partners, so obviously the budget discussion that we've just had has set some of those concerns to rest, at least for the next 12 months, hopefully. I also previously reported there's an ambition to improve the frequency and content of meetings of the Audit and Performance Committee. And at our meeting on the 24th of February, there was proposals for revised terms of reference, and these are included in today's agenda. So we'll be able to talk about that a bit more fully. In terms of performance, there was no items of concern raised with respect to the standard reporting on the key strategic indicator performance report and the performance strategy and framework development. And similarly with the strategic risk framework and update, any actions are being managed. There's no areas of alarm or concern raised. And the annual performance report and governance is included in today's agenda as well for noting later on. We also got a report on the partnership improvement plan. This improvement plan consolidates all the actions and recommendations arising from the IGB's annual review of governance and other self-assessments, and the internal and external audit recommendations and other external inspections. Work is progressing well in developing the partnership improvement plan, and so far there are no areas of concern identified, and hopefully the improvement plan will be ready for full review in fairly shortly. Regarding audit matters, the committee approved the reappointment of Perth and Kinross Council's Jackie Clark as the Chief Internal Auditor, to be supported by the Perth and Kinross Council Internal Audit Service and the Fife, Tayside and Forth Valley Internal Audit Services as the IGB Internal Auditors for 25-26 through to 27-28. It's a period of 3 years. Following that, our Internal Auditor presented an update on the progress of the Internal Audit Plan. Again, no notable areas of concern. There was an audit report on the sustainability of commission service providers, and this was considered by the committee, looking at the effectiveness on our internal controls. While the audit has found that reasonable assurance can be placed on the Council's internal controls in relation to the sustainability of commission service providers, the auditor cannot at this point properly assess best value or the extent to which the commission services are delivering the desired outcomes. There are specific actions arising from the findings in relation to this, including that some service providers submit invoices late, which gives some concern around cash fluidity, etc., and that contract monitoring is not fully recovered from COVID. However, there is a management action plan that was presented to the Audit and Performance Committee in place to address these issues. And once these actions or this action plan is completed, internal audit should be able to place substantial assurance on the control arrangements in place internally. And in terms of financial matters, the external auditor fee for Perth and Kinross Integration Joint Board is going up by 1.9% from last year. It's an increase from £33,360 to £34,000, a nice round number. I want to take this opportunity actually to thank officers for their ongoing effort and due diligence regarding all areas of performance, risk, governance and audit matters that come before the Audit and Performance Committee. The fact that there's no substantial issues of concern that are raised, there's no big surprises that come along, there's nothing that isn't being already addressed, I think is a real testament to their hard work and engagement. And also that we have excellent transparency and continuing progress and improvement. Certainly for myself as the chair and other forums. So I think a big, round of applause. No, maybe not round of applause physically, but thanks to all of the officers who do that, particularly at this very busy time of year when there's financial pressures and all sorts of other things going on. And just a final point I would like to make is that committee services has reminded me that we have a vacancy on the Audit and Performance Committee. I think the previous post holder was, I think, Sandy Watt. So we need to fill that vacancy and hopefully we'll do so before our next meeting. So if anyone is interested in taking up that role, please let me know. And of course, just a reminder that any member of the IGB can attend the Audit and Performance Committee meetings to see for themselves what's going on. That's the extent of my report today. Thank you very much.
Thank you very much, Councillor McCall. Are there any questions on the work of the Audit and Performance Committee? Mr. Henderson.
So I sit on that committee, and when I saw that there was an audit on sustainability of independent sector and providers, I thought it might be a bit more far-reaching than what it actually was, rather than just internal processes, which was, I didn't know the purpose of the audit. Some of the things they raised have been there for a number of years. The invoicing, there's still not an electronic system. There is an electronic system for paying care homes, so there's an opportunity there. I'm just wondering if there's an opportunity, given the concerns we've got with the independent sector and third sector about sustainability, if this could maybe be revisited and look at the whole sustainability of the sector rather than just internal processes. Thanks.
In terms of the scope of the audit, we can certainly discuss that with the internal auditor and see if that's a possibility.
And I suppose just to add to that, that the timing of the audit that was carried out, there's been a lag in terms of the reporting of that. So the scope was defined before we knew of the issues that have been under discussion today. So it's not that that was missed off in terms of the work that was carried out. It was not an issue at the point of time that the audit was carried out. So I think it's important to recognise that. So it's not a deficiency in the scoping of the audit. I mean, and that's something I think, yeah, in terms of the risks that we bring forward in the future, which are linked to the internal audit plan, I can certainly see that that would be something that will be coming forward, Dave.
Yeah, I think you'll know, David, from the management action plan, I was just going back checking it there. One of the things that we are a little behind in is in contract monitoring, and part of that probably should include, just financial arrangements, etc. So we can certainly take that on board as well and see if we can incorporate some of that, so it's more of an ongoing basis rather than just a one-off audit.
And a comment from Councillor Elling.
Yep, thank you. Yeah, I'd like to agree with Councillor McCall that it's a committee where very little surprising turns up, and while it could be conceived that this important work is thought as quite dull, that's exactly the way it should be, and I'd like to thank everybody in the finance team for that. Thank you.
Thanks. And Mrs. Robertson, you wanted to come in.
It's just to make a comment about the action regards contract monitoring. Contract monitoring is entirely up to date. I think the lag in the report means that report was immediately off the back of COVID, where contract monitoring at that point in time didn't happen because we couldn't go into services. So there's no delay in contract monitoring activity now.
Okay, thanks for that clarification. If you've got no more questions or comments on the Audit and Performance Committee, we will proceed to item 9.1 on the agenda, which is our Equality Outcomes Progress Report for 2025. Chief Officer.
Yeah, thank you very much, Chair. Happy to introduce this report. The IGB is asked to approve the final report on progress of the 5 equality outcomes that had previously been approved by the IGB in 2021. And the detail of progress against these outcomes is set out in Appendix 1 on page 23 of the supplementary papers. Mark Dixon, who's our clinical and care governance coordinator, is here because Mark has responsibility and has been monitoring progress in relation to those outcomes and prepared that for us today. So Mark's with us to answer any questions you may have on this. In addition, the report sets out as a reminder of the legal duties of the Integration Joint Board under the Equality Act 2010. And the general equality duty that applies to all public bodies, and these are set out in paragraphs 2.1 to 2.5 and in 2.10. It also, I think, illustrates the importance placed upon and commitment to equality, which is evidenced in the IGB's discussions, actions and its strategic planning. The 5 equality outcomes approved in 2021 align to NHS Tayside and Perth and Kinross Council's equality outcomes, and the progress refers mainly, you'll see in that, to what has been achieved by those bodies as the employers of staff within the Health and Social Care Partnership as the delivery vehicle for delegated health and social care services. But within this report, the IGB is asked to approve a new set of four, so we've gone from 5 to 4 equality outcomes from 2025 onwards, which are more aligned or more closely aligned to the specific roles and functions of the IGB itself, recognising that the strategic plan and the participation and engagement strategy are vehicles through which the IGB directs services to address health needs and inequalities. So as a partnership, health and social care partnership, we will go on to prepare a mainstreaming equality report in that regard and bring that forward to the IJB along with a smart action plan. So the proposed 4 priorities are set out in section 3 of the report and relate to the IJB's role and purpose, and relate to areas that have been highlighted by IJB members in both formal IJB meetings and in development sessions. So there are 4 for your approval, and those are outlined in the report. And happy to take any questions, and Mark is here to answer questions on the progress update. Thanks.
Thanks, Chief Officer. I'm looking round for questions or comments and online, but I'm not seeing any. No? Okay. If there's no questions or comments on this, then can we note the progress report in relation to the equality outcomes previously approved in 2021, approve the revised set of 4 equality outcomes for 25 to 28, which are relevant to the IJB's strategic role, request annual reporting of an assessment of progress towards the revised equality outcomes, and note the intention of the Health and Social Care Partnership to publish a mainstreaming equalities report aligned to our strategic plan. Agreed. Thank you very much. Item 9.2 on the agenda is annual performance report governance. Chief Finance Officer.
Thank you. Me again. I feel like I should apologise for that. But thank you to Chris Jolly for preparing this report, but I'm happy to introduce it. This report proposes a new approach to seeking approval for the annual performance report, and this will ensure timely publication and compliance with our statutory obligations. So the IJB is required to publish an annual performance report by the end of July each year. And it's required to assess the performance against the national health and wellbeing outcomes. This proposed approach removes the need for an additional summer meeting of the Audit and Performance Committee, allows the annual performance report to be approved by the Chief Officer and the Chair of the Audit and Performance Committee, and then for it to be considered by the IJB within 1 month of its publication. The benefits of this will mean that we remain compliant with statutory obligations, that we will be following similar processes to neighbouring IJBs. I guess most importantly, it will improve our ability to meet the deadline, as it's currently problematic due to the availability of the national data sets. And these are required for inclusion in the report. And presently what it does is it leaves us with a very short period to finalise the report. And this proposal will eliminate the need for that additional 1-item agenda meeting. So it's proposed that this is an approved change, and happy to take any questions.
Okay. I don't think you're going to have to take any questions because I'm looking round and I'm not seeing any hands going up and nothing coming in the chat. So can we therefore agree to delegate authority to the Chief Officer and Chair of the Audit and Performance Committee to authorise the annual performance report to be published by 31st of July 2025, and request that the annual performance report is submitted to Audit and Performance Committee for formal approval at the meeting scheduled for 25th of August 2025, and thereafter to the IJB for noting. Thank you very much. That's agreed. Oh, Chief Officer, you want to come in?
Just to say, I'm very pleased with that decision, because what it does mean is that the hard work of staff and those who may have to meet during a recess period is being acknowledged, and July is a very busy month as it is. So thank you very much for that.
Thank you. Item 9.3 on the agenda is the Chief Social Work Officer's annual report for 23-24. This has already been considered by Perth and Kinross Council back in December, I want to say. Mr. Singh, do you want to introduce the report?
Thank you, Chair, for the opportunity to present the annual Chief Social Work Officer report to the IJB today. And as you noted, it was presented to full council in December and was submitted to Scottish Government in November of last year. You'll be aware this report is presented to the IJB on an annual basis as part of our governance and assurance arrangements. And the IJB today is asked to note the contents of the report. The IJB will note that the report comprehensively details all social work activity and social care activity that's delivered both by the Council and the Health and Social Care Partnership in respect to children, justice and adult social work services, and noting that many of these areas cross over their service areas. The IJB will see in section 2.4 of the report specifically, which details information in relation to adult services, in relation to adult protection concerns and adult protection, adult support and protection activity, which shows better multi-agency responses to safeguarding concerns. There's clear evidence of a significant reduction in waiting times for initial screening of referrals to the access team, and time between contact and assessment following a service redesign. That's detailed within the report. The report also shows the early signs of the re-enablement and care at home transformation programme, which obviously dovetails in with the report that the IJB heard earlier on from Zoe as well. The report also notes the extensive activity that's been undertaken by the Learning and Development Board team, in relation to the significant increase in student placements from 8 in 2022 to 25 in 2023. Also a proactive recruitment campaign in relation to social care as well, and that team continues to build on the learning opportunities across the workforce as well. So the board today is asked to take assurance from the report that despite the challenging social care environment, we continue to innovate and improve our responses to those who are most in need of services.
Thank you, Chief Social Work Officer. And I think we've got this down on the agenda for the next development session for a deeper dive into it if there are any questions. But if there are any burning questions at the moment, happy to take them. No. Okay, thank you very much, Chief Social Work Officer, and thanks as well to. I mean, this is a good report and it's very reassuring. So thanks very much to all of the staff within social work, and to yourself for presenting the report. Can we note the contents of the report as it pertains to the delivery of adult social work services delegated to this board? Agreed. Thank you. Next item on the agenda, 9.4, is the revised terms of reference for the Audit and Performance Committee. These have already been agreed by the Audit and Performance Committee, but it falls to the board to formally approve the terms of reference for a subcommittee of the board. So, Chief Finance Officer.
Thank you. Yeah, so this recommends the approval of a revised terms of reference for the Audit and Performance Committee. The terms of reference for the committee were last refreshed in September 2021, and as part of good governance practice, a review of those terms of reference has now taken place, with this new version having been produced. The new terms of reference strive to provide a clearer structure with distinct sections and headings to make it easier to read and understand. It provides updates on the performance with more contemporary language and reflects the current work on the performance management framework and the broad role of the committee in overseeing the scrutiny of this. The main changes that I would draw your attention to is that the audit section now includes the committee's role in appointing and terminating the Chief Internal Audit Function. It includes the Partnership Improvement Plan and mentions it specifically in this version to reflect the importance of this document to the committee. And finally, the annual accounts has its own specific section, and that's to reflect that this is a major piece of work for officers, and one of the key roles of the committee is in approving the draft and final accounts. So recommending for approval. Thank you.
Okay, I think we're going to be flying through the rest of the agenda. Are there any questions or comments on the revised terms of reference for the Audit and Performance Committee? Oh, Mrs. Auld, online.
Thank you. A suggestion and maybe a question, would it be possible for papers of this type to be supplied to the board with the proposed changes to make it easy for those of us that aren't sort of fully au fait? So just the changes that the finance officer has gone through there, it would be really helpful if they were attached to the paper. Thank you.
Yeah, thanks for the question, Mrs. Auld. I'll take responsibility for this. In order to try and simplify the papers, we just included a hyperlink in this, but the actual changes were outlined in the covering report that was considered by the Audit and Performance Committee, and it was I should have made sure that there was a link to that covering report as well as to the revised terms of reference. But a point well made, and I will try not to forget that in future. Are there any other questions or comments, or can we approve the revised terms of reference for the Audit and Performance Committee? Approved, agreed, thank you very much. Next item on the agenda is, the next items on the agenda are for information, but we will allow any questions on them. So the first one is the Strategic Risk Management Framework for 2025 to 28. Are there any questions, or can we note this revised framework? Councillor Illingworth.
Are there plans to use a PK Performs package that PKC use?
Yes, the answer to that. And if we look ahead to the work plan for the development sessions for the IJB, we've got PK Performs down later in the year. If there are no other questions, we will note the Strategic Risk Management Framework for 25 to 28. Next on the agenda is 10.2, NHS Teesside Director of Public Health's Annual Report for 24-25. As I indicated at the start, we did have a development session with Dr. Fletcher last Friday on this, and there was a really good amount, I think, of questioning and deep diving into that. But again, formally, if there are any questions or comments, I'm happy to entertain those today. And Councillor McCall, I see you have one.
I have, thank you very much. I think that, I suppose my comment is that a lot of the determinants of improving some of the population health reside with the council. So I'm hoping, and I'm pretty sure that we'll be doing some work collaboratively to try and reach common understanding of what needs to be done and what priority. So I just wanted to perhaps give some reassurance from the council's point of view that will be taken forward. But I think one of the most stark things that I've seen in this report relating to Perth and Kinross specifically is the widening gender gap in healthy life expectancy. And I think that I would hope that for this IJB, it's something that we would perhaps look at very closely and prioritise, because it says in the report itself, we don't really understand why that is happening here. And it's a bit of a reversal. So people are living longer, which is good, and the life expectancy is generally on the right trajectory. But for some reason, the healthy life expectancy for women in particular is going down. So I think that perhaps we need to maybe not hold development session, but we certainly need to have perhaps some focus on that going forward and try and understand what the root causes are. Thank you, Chair.
Thanks, Councillor McCall. Agree with that. And maybe just to acknowledge as well that Mr. Jones is chair of the, I wanted to call it Public Health, but it's Population Health Committee at NHS Teesside, so particularly useful as well to have that a membership on the board. But Dr. Douglas, you want to come in?
Yeah, I suppose one of the issues around healthy life expectancy for women generally is they experience the double whammy of deprivation and gender inequalities, and that's why even at a national level there's always a difference, particularly the proportion of life spent. I think as well in terms of, and I was trying to look at the period of which that data's for, there's always, I suppose, anomalies in the data. So whilst I think it's something absolutely we need to monitor, but it's kind of looking at that in a perspective of trend and where we are in terms of trend data in that. So absolutely need to look at that, and some of the causes should that trend continue to go in the wrong direction.
Thank you. And Chief Officer, you wanted to come in on it.
Yes, thank you very much, Chair. I just think it's helpful to note as within the minute of this IJB meeting that as part of the development session we had a discussion around the connectivity of the work of the Health and Social Care Partnership, the IJB strategic plan and the community planning partnership. And we know that although Dr Fletcher is leaving NHS Tayside, she has prepared and committed to finalise a health and wellbeing strategy as part of the community planning partnerships work, with a focus on health and wellbeing. So really important to ensure that that connection's there and that we continue to strengthen that and that we take that forward. But I think it's important to know that as part of the minute.
Okay, thank you very much. Are there any more questions at this stage on the Director of Public Health's annual report for Mr. Black?
It's just an observation as opposed to a question, and it's under 5.1 substance use. When you see all the factors under substance use, drug and alcohol use in Tayside and P&K as well, it's all gone up. Against the Scottish average, it's all gone up. So there has to be some recognition that there'll be financial implications on the Health and Social Care Partnership by that. And but with the amount of effort that's going in, it should be going down, but it's not, it's going up.
Thanks, Mr. Black. I think that's a point well made. There are no other. Oh, Mrs. Summers.
What Martin's just said, is there anybody looking at that to see where that is happening? Because I mean, it's quite, I mean, it's increased. But I mean, we have been above Scottish average for a while, but it looks like it's increasing, like, you know. So I mean, is there anybody looking at this? I don't mean anybody, I mean anybody of, you know, people looking at this.
Sorry. Hi, yeah, I chair the Alcohol and Drugs Partnership, and there's a fair bit of work being taken forward across all sectors to on a number of fronts. One is to bring the awareness of the work that we're doing, and I guess the sort of best practice that can be embedded across the sectors into conversation more. Secondly, we're looking at ensuring that our services are meeting the need or are aligned to the data and our understanding of the population needs with regards to substance use. And also we're potentially looking at redesigning our services. So there's a lot of activity taking place. In fact, there's an event we're arranging moving forward. We have far greater involvement in the Alcohol and Drugs Partnership now that stems across police, ambulance services, local authority, prison, for example, so that we can better understand the findings of all people and how we can respond more appropriately. So I'm happy to feedback once we've had some of these events, but certainly a lot of activity taking place.
Okay. Thank you. Can we note the Director of Public Health's annual report for 24-25? Thank you. When we returned from recess, I meant to just make a note that Nettie Sutherland, our new service user public partner representative, had been trying to get into the meeting, but and colleagues from committee services have been making strenuous efforts to achieve that, but it wasn't possible due to IT issues. So we'll just note that in the minute. Last item on the agenda then is the future work plan and development sessions and meeting dates. Are there any questions on the work plan for the IJB or for the development sessions for the IJB? No, no comments. Okay, thank you very much then. That concludes this meeting of the Perth and Kinross Integration Joint Board. Thank you very much to all members for your attendance and engagement, and to all officers for the report, the huge amount of work that's gone into bringing forward the reports for quite a busy agenda this afternoon. Thank you very much.